Parkinson's disease is a neurological disease. Look at this brain images. It shows that CT findings, MRI images, detail going on. Introduction. Parkinson's disease is a progressive neurodegenerative disorder that particularly affects movements. It is characterized by the loss of dopamine producing neurons in the substanda nigra, a region of brain. The disease progresses over time, leading to worsening symptoms and increasing disability. Definition: Parkinson's disease is a chronic and progressive movement disorder resulting from the degeneration of dopamine producing neurons in the brain. Dopamine is a neurotransmitter that plays a key role in sending signals to the parts of the brain that control movement and coordination. Types. There are several types of Parkinson's disease, including idiopathic Parkinson's disease, the most common form with no known cause. 2. Secondary Parkinson's disease results from other conditions or factors such as medication, side effects, brain injuries, or infections. 3. Atypical Parkinson's disease. Parkinson's pulse syndrome includes disorders like multiple system atrophy, progressive supraannular palsy, and corticobasal degeneration. Causes. Exact cause of Parkinson's disease is unknown, but several factors may contribute, including 1. Genetic mutations in specific genes such as LRRK2, PARK2, and SNCA can increase the risk. Second, environmental factors. Exposure to toxins like pesticides and herbicides. 3. Age. The risk increases with age, particularly after age 60. 4. Sex. Men are more likely to develop Parkinson's disease than women. Risk factors. 1. Age, most common in people over 60. 2. Genetics, family history can increase the risk. 3. Sex, men are more prone than women 4. Exposure to toxins, ongoing exposure to herbicides and pesticides. 5. Head injuries, severe and repeated head injuries may increase the risk. Complications: 1. Cognitive impairment, memory deficits and slower thinking. 2. Emotional changes, depression, anxiety and apathy. 3. Swallowing problems. Difficulty swallowing can lead to aspiration, pneumonia. 4. Sleep disorders, insomnia, REM, sleep behavior disorder and restless leg syndrome. 5. Bladder problems, inconsistence or difficulty urinating. 6. Constipation due to slow digestive processes. Pathophysiology: Parkinson's disease is marked by the loss of dopaminergic neurons in the substantia nigra parts. Compata: the loss of these neurons leading to decreased dopamine levels in the striatum, resulting in impaired motor function. The presence of Lewy bodies, abnormal aggregates of the protein alpha synuclein is also a hallmark of the disease. Signs and symptoms: 1. Tremor, resulting tremor typically starting in the hand or fingers. 2. Bradykinesia, slowness of movement. 3. Muscle rigidity, stiffness in the limbs and trunk. 4. Postural instability, impaired balance and coordination. 5. Masked facial expression, reduced facial expressions. 6. Micrographia, small, cramped handwriting. 7. Shuffling gait, short shuffling steps. Diagnosis is primarily clinical, includes 1. Medical history, detailed history of symptoms. 2. Neurological examination, assessing motor symptoms and reflexes. 1. Imaging tests, MRI or CT scan to rule out other conditions. 4. A DET scan, a specialized imaging technique to visualize dopamine transporters in the brain. Look at this picture, shows that DET scan. Nursing diagnosis: 1. Impaired physical mobility related to muscle rigidity and bradykinesia. 2. Self-care deficit due to tremors, and motor impairments. 3. Impaired verbal communications from reduced facial expression and speech changes. 4. Risk for falls due to postural instability and shuffling gait. 5. Chronic confusion related to cognitive impairments. Management and treatment. 1. Medications. Levodopa converts to dopamine in the brain. Dopamine agonists mimic dopamine effects. MAO-B inhibitors slow dopamine breakdown. COMT inhibitors extend the effects of levodopa. 2. Surgical treatment, deep brain stimulation, implanting electrodes in the brain to stimulate regions affected by Parkinson's disease. 3. Physical therapy, improve mobility, balance and flexibility. 4. Occupational therapy helps with daily activities and adaptive techniques. 5. Speech therapy addresses speech and swallowing difficulties. Psychosocial medicine. 1. Support groups provide emotional support and shared experiences. 2. Counseling for patients and caregivers to cope with emotional and psychological challenges. 3. Education, informing patients and families about the disease and management strategies. Prevention. There is no known way to prevent Parkinson's disease, but some strategies might reduce the risk. 1. Healthy diet. Diet rich in fruits, vegetables and antioxidants. 2. Regular exercise, physical activity to maintain overall health. 3. Avoid toxins, reduce exposure to pesticide and herbicides. 4. Monitoring, regular checkups, especially if there is family history. Conclusion. In conclusion, Parkinson's disease is a complex, progressive disorder with significant impact on the quality of life. While there is no cure, various treatments and management strategies can help alleviate symptoms and improve the daily functioning of those affected. Ongoing research continues to seek better treatments and ultimately a cure for this debilitating disease. Thank you. Have a wonderful day.